Greetings everyone. Today we will be seeing on the topic rationale of endodontics. So an injury to the calcified structure of the teeth will result due to noxious stimuli, and this may cause changes in the pulp and the periradicular tissues. So the noxious stimulus could be physical, chemical or microbial pathogens. So this can be either reversible or irreversible in nature. Whether it is reversible or irreversible is decided based on the intensity, duration, pathogenicity and host defense mechanism. The stimulus could be either mild to moderate. So if it is mild to moderate, it can result in sclerosis of dentinal tubules, reparative dentine formation and reversible inflammation. If it is severe injury, it can result in irreversible inflammation, which could result in necrosis of pulp and pathological changes in the periradicular tissues. Inflammation is the local physiological reaction of the body to noxious stimuli or irritants. During inflammation, there are series of changes that can happen. One, it is the physiological changes. Second, it could be morphological changes. The physiological changes can be either vascular, lymphatic or even connective tissue changes. The immune mediated changes includes the inflammatory changes and the immunological changes. The inflammatory changes are based on the response to the stimuli and the immunological reactions are based on the regulated changes. The basic objective of the rationale in endodontics is all these reactions takes place to eliminate the irritants and repair the tissue damage. During inflammation, the phagocytic cells, the antibodies and the fibrin come into action. The role of phagocytic cells includes digestion of bacteria and the remaining cellular debris. The antibodies come into action to recognize the attack and destroy the foreign body. And the fibrin, which comes at the last, limits the spread of the inflammation. The inflammation are of two types, acute and chronic. In acute, the polymorphonuclear lymphocytes and few macrophages, which is the innate immunity, come into action. In chronic, lymphocytes, macrophages and plasma cells, which is the adaptive immunity, come into action. There are basic 5 signs of inflammation which you can notice: rubor, tumor, color, dolor and loss of function. The rubor means redness, tumor means swelling, color, this heat which is generated, dolor which is pain and the loss of function. In pulp, it is basically dolor and the loss of function which is highly recognized, which is clinically recognized. First and foremost, the repair is at the first stage. The pulp tries to repair itself. If it is repaired, new blood vessels, fibroblasts or collagen fibrils are formed, which results in granulation tissue formation. However, if there is beyond the reparative capacity, it causes irreversible changes which results in endodontic treatment for the survival of the tooth. The rationale of endodontic therapy is to complete debridement of root canal system followed by 3-dimensional obturation. Let's look into theories of spread of infection. The first one is focal infection. It is generalized or general infection caused by dissemination of microorganisms or toxic products from the focus of infection. The focus of infection is the circumscribed area of tissues which is infected with exogenous pathogens, microorganisms, and is usually located near mucus or cutaneous surface. The oral foci of infection is the possible source of infection in the oral cavity, which later on may set up distant metastasis. The infected periapical lesions are periapical granuloma, periapical abscess and periapical cyst. These are the various blood cells which comes into action during inflammation. The first defense action is done by neutrophils, which are of two types, the primary and the secondary. The function of these neutrophils is the phagocytosis of bacteria, lyse the fibrin and cellular debris. This is the way the bacteria is phagocytized by the neutrophils. The second one, which comes as the first line of defense, is macrophages. The macrophages are derived from the circulating monocytes. If it is circulating, it is known as monocytes. If it is present in the connective tissue, it is known as macrophages. The macrophages ingest the cellular debris and microorganisms and particulate matter. So, it possesses the major histocompatibility complex which is involved in phagocytosis. So, these macrophages are the osteoclastic precursors which is then formed into rank or rancle. This rank or rancle causes the bone resorption. This is the presence of osteoclasts, or this is the presence of macrophages in tooth. Okay. Second is lymphocytes. Lymphocytes are of two types, T cell lymphocytes and B cell lymphocytes. The B cell lymphocytes are the pluripotent stem cells. The stem cells are derived from thymus and bone marrow. If it is derived from thymus, it is the T cell. If it is derived from bone marrow, it is the B cell. The T cell is long span and the B cell is shorter lifespan. It is basically found in the paracortical region. The eosinophils are responsible for allergic and parasitic reactions. The basophils are derived from the hemopoietic system and the mast cells are present in the tissues. The function of these is to stimulate are stimulated by tissues or injury, which results in regranulation. On degranulation, it causes chemical mediator release such as histamines. The histamines causes inflammation, allergic reaction. In the vascular changes, there is vasodilation which is present. The vessels are actually initially having vasoconstriction. On injury, it has vasodilation. So once there is vasodilation, there is opening of dormant capillary bed which increases blood supply. So this is an image of vascular changes that happens. So where does it happen in the tooth? It happens in the pulpal tissues of the tooth. Then there is immunological consideration. Wanton and Langeland stated that the antigens placed in the pulp sensitize the host. It is the formation of antigen-antibody complex which is present in the apex of the tooth. During the induction of immune response, once there is an exudative phase of inflammation, there is a presence of foreign substance. This foreign substance will cause pulpal and periapical tissue inflammation. During inflammation, there is an area of injury present. So in this area of injuries, there is going to be granulating phagocytes, that is the neutrophils and macrophages which will come into action. This will destroy and get rid of the foreign materials. So there is an antigen presenting cell present which is generated by the immune response. The existing inflammation causes influx of microbial antigens and trauma. This will cause influx of antigen material which is also derived from the T cells and B cells and causes memory T cells and B cells. The role of immune system in inflammatory process is that it augments and enhances the acute aspects of inflammatory conditions. The T lymphocytes is identified within the periapical lesion and the most prevalent one is B lymphocytes. This will result in granuloma. So the humoral mediated immunoglobulins will result in phagocytosis process and the cell mediated stimulation B cells causes antibodies. So this is the flowchart of the delayed hypersensitivity reaction. The tissue changes that is happening during inflammation is number one, fibrous, resorptive and calcific, which is the continuous degeneration of the tissues as a result of necrosis, and suppuration. Suppuration as in liquefaction, necrosis or the formation of pus. There's also going to be proliferative changes. The proliferative changes such as fibroblast, which will lay down cellular fibrous tissues. In some cases, collagen fibers may even be substituted by dense acellular tissues. So the response of the periapical or host tissue is controlled by cells, molecular mediators and antibodies. The periradicular manifestation is started by partial or total necrosis. This from the root canal, it serves as a pathway of noxious substance to the periradicular region. From the periradicular region, there is going to be bone resorption or granulation tissue formation, and this is a pathological situation due to hypersensitivity reaction. So the pathophysiology of pulpal disorder is that there is going to be an insult. The insult is going to cause inflammation. The inflammation will cause vasodilation. So the vasodilation, there is going to be metabolic factors which are released. There is going to be increase in viscosity. The permeability is going to increase. There is going to be filtration, edema and increase pulpal tissue pressure. That will cause resistance of the venules, which will cause local pulp tissue necrosis, and then if it is not treated, it will cause total pulp necrosis. So the endodontic implication was given by Fish, which is known as Fish concept, which was given in the year 1939. He concluded that the removal of nidus of infection will result in the resolution of infection. There are various zones which are present in Fish concept, which are basically 4. The first closest to the root is the zone of infection, then comes zone of contamination, then comes zone of irritation and zone of stimulation. In zone of infection, we have the bacterial debris or the polymorphoneutrophils and the macrophages which comes into action for the digestion of the bacterial cells and the cell debris. Second is the zone of contamination. Zone of contamination, we have lymphocytes and round cell infiltration which causes the reduction of your zones. Third is the zone of irritation. Zone of irritation is caused by histocytes and osteoclast. Finally, zone of stimulation. Zone of stimulation has fibroblast and osteoblast. There's one more theory known as Norfield's mountain pass theory. Here it is just a story wherein it is divided into 3 parts: zone A, zone B and zone C. Zone A is present inside the root canal. Then comes your mountain, which is the root apex. Then comes the plain, which is the zone B, which is the periradicular region, and zone C is also the periradicular region. The bacteria which is coming from the zone A will try to come out through the mountain. So that is the mountain pass. Okay, once it crosses, it reaches the terrains, the normal land. So there we have all the polymorphoneutrophils and the first defense cells which are present for acting against the bacteria. Then when there is a war which is going on, there is going to be mass amount of debris which are released. This will be removed by the zone C, which is the fibrin or the fibroblasts, which will be laying down the normal tissues in that particular region. Then comes the cyst formation. Cyst is due to proliferation of epithelial cells and inflamed periodontal ligament. So it is present in case of chronic inflammatory cells. There is going to be nutritional deficient theory which you need to know. That is, during the growth of cell, there is going to be island of epithelium which grows from the center to far away. So during this, there is going to be cut off of the nutritional supply. So as a result, there is going to be necrosis and liquefaction degeneration. Wound healing or apical periodontitis. It is enhanced either by surgical or non-surgical methods of endodontic therapy. Absence of inflammatory mediators because of elimination of inflammatory cells. To conclude, the damaged tissue within the root canals undergoes autolysis and resulting of breakdown of products which will diffuse into the surrounding tissues and cause periapical irritation associated with the portal of exit. It is therefore necessary that the endodontic therapy must seal the root canal system 3-dimensionally so as to prevent tissue fluids from percolating in the root canals and toxins. Thank you.